Hi, Brian. I will be your nurse today. My name is Madeline. So what are you in for here today?
To help you.
Okay, with my validation, thank you. Can I see your identification bracelet? Can you give me your name and date of birth?
Brian Estrada, 2006, September 23rd.
Okay, thank you. I have provided privacy for the patient. So I've already performed hand hygiene as indicated and put on PPE as indicated. Do you have any allergies that we need to be aware of?
No.
No allergies, okay. And then, so I'm going to be taking a look at your skin, hair, nails, your head, ears, nose, throat, your lymph nodes, and also your lung sounds. Okay, so I'm going to start off by assessing your skin. Let me just see your extremities here. Skin is warm and dry to touch. No excessive dryness. Hair is distributed evenly amongst bilateral extremities. I don't see any bruises, any ecchymosis, any purpura. I don't see any striae. I don't notice any body odor. I don't see, do you have any piercings? No, no piercings. I don't see any piercings, any tattoos, correct? No tattoos. Turgor seems appropriate. No signs of dehydration based off of the skin. Then I'm going to inspect the hair on your scalp and your body. I've seen here on your arms is evenly distributed. Would you be able to pull up your pants for me a little bit? Okay. Both legs. There is even distribution. Again, no lesions, no bruising, no scars or anything on either bilateral lower extremity. Hair is distributed evenly, warm and dry to touch. All right, so let's take a look here at your scalp. Now, hair is wet. Did you just come out of the shower?
Yeah.
Okay, so this isn't sweat or anything. All right, so I don't notice any lice. I'm feeling for any bumps. Does this hurt at all? No tenderness. Scalp is freely movable. Hair is evenly distributed. There's no signs of missing hair or anything. There's no graying. And then body hair. Do you have body hair yet? Just on the legs and arms. We're not there yet. There was no dandruff noted. And the texture of his hair is consistent with straight hair texture. It's not rough or dry hair. Looking at your nails, both for your hands and your feet. Would you say you bite your nails?
Yeah.
Okay. Now you haven't had any bleeding or anything from your nails?
No.
Is it painful at all from the biting? Okay. So nails are a little bit, have a bit of a rough contour to them from nail biting, consistent with nail biting. I don't notice any indentations, any clubbing. Capillary refill is pretty immediate. Yeah, I would say less than 1 second. Let me check out on this hand. Nails don't feel thin. They are of normal thickness. They are a bit on the short side. Let me go ahead and see your toenails as well. And then over here. Yeah, all nails, they are clean. Again, capillary refill is normal. Nail beds are pink in all extremities. Now we're going to be assessing your facial features. So let me look at your Eyebrows, hair is evenly distributed through them. They are at equal level. They're symmetrical bilaterally, along with, can you look up at me? The palpebral fissures of your eyes. They are of equal symmetry. I see you're able to move the sides of your mouth right now, symmetrical. Your nasal labial folds are also symmetrical. Facial expressions are appropriate. Skin is smooth. No irritation noted, no erythema, no redness, no lesions. Very mild scarring on the left cheek. It probably looks like you pick a little bit at probably some little blackheads. So I'm gonna have you sit up for me. I'm going to feel the joint here in your mandible. I'm just gonna feel to see if there's any crepitus or anything. So go ahead and open your mouth for me and close. Okay, you don't feel either any popping or any discomfort when opening and closing your jaw. Okay, so I'm gonna feel your sinuses. Let's start off with your frontal. Do you feel any tenderness here? I don't feel any swelling. This is warm to touch, consistent with the rest of the body. No extra warmth. And let me see here for your maxillary sinuses. You don't feel any pain or anything. Okay. Okay. Yeah, I don't notice any outside of the normal resonance during percussion of the sinuses. And now I'm just going to palpate your lacrimal apparatus. This runs right along your nose. You don't feel any tenderness here, do you? Okay. I'm going to be inspecting your eyes, the irises of your eyes, your pupils, the sclera, and the conjunctiva. Go ahead and look up at me. Pupils are the same size. The iris is the same color and properly aligned as patient looks at me. I don't see any signs of strabismus. Sclera is china white. I don't see any signs of jaundice. The surface of the cornea looks to be smooth with appropriate transparency. And again, the eyebrows and the eyelashes, they look to be evenly distributed. Normal texture of the hair, the eyelashes are curved upward and outward. Focus on something distant in the background. Okay. The light that's shown off of his eyes is equal on both eyes, which indicates appropriate corneal light reflex. I'm going to assess that your pupils are consensual to the reaction of light. So go ahead and look at my top ear here. Okay. Left pupil constricted along with the right pupil. I'm going to go ahead and look at my other side of my ear. Okay, and the same vice versa. So there is consensual light reaction of both eyes. Pupils were equal, round. They reacted to the light. And now I'm going to test for accommodation. So go ahead and look at a distant object. All right. And then I'm going to have you look at my pen light. Okay, and there is appropriate accommodation in both eyes. The pupils look to be about 3 millimeters in width. So now I'm going to test your cardinal fields of gaze, okay? So look at the tip of my pen lights. Go ahead and follow it, okay? Okay, all right, thank you for that. No nystagmus was noted. The eyes both were able to follow the pen light without any difficulty. Okay, so now I'm going to assess your nose now. Your nose seems to be symmetrical. It is centered on the middle of your face. All right, so I'm gonna go ahead and palpate your nose. Tell me if you feel any tenderness. Any tenderness?
Mm.
Okay. And both nares are of equal size. I'm gonna have you close one side of your nostril and breathe out of the other one. Okay, you're able to breathe. And now compare the other nostril. Can you breathe equally out of them?
No.
Okay, so then I'll be sure to mention that to the doctor and see if he wants to give you a referral for a ENT, okay? All right, so now I'm going to look at your ears. Would you mind putting your hand down? Okay, so they are at an equal height and equal size. So I'm gonna go ahead and look at each ear. I do not see any lesions, cerumen, irritation on the left ear. And the same for the right ear. Tell me, do you feel any tenderness or anything when I palpate?
No.
How about on this side?
No.
Okay. I didn't notice any discharge either. Both ears are of the same skin color. So now I'm going to assess your mouth. Your lips don't look chapped, so I'm gonna say you look, lips are moist. For the inside of your mouth, do you have any cavities, bleeding gums, or any fillings? Can you open up your mouth for me? Let me see. So tongue looks pink and moist along with the buccal mucosa. Can you open up a little bit more for me? Say ah. It looks like the tonsils are 1+ bilaterally. No halitosis was noted. Palate was also pink and moist. The uvula was midline and elevated with the posterior palate when you said ah, which is appropriate. The anterior and posterior pillars, everything was matching pink and moist. So now I'm going to be moving on to your neck and trachea. Can you look up for me? Okay, trachea appears midline. Neck has a normal appearance. I do not see any bulging from the possible thyroid or anything. So I'm gonna palpate your neck and make sure. Do you feel any tenderness?
Mm-mm.
Okay, I don't feel any immediate swelling, bumps, no lesions, no discoloration. But now I'm going to be moving on to your lymph nodes. Can you just, before we do that, can you turn your neck to each side? Do you feel any pain or anything with movement? Go ahead and go up and down. Okay, perfect. Okay, so let's go ahead and look at your lymph nodes now. So pre-auricular, post-auricular. Can you be seen here? Okay, occipital, the jugulodigastric, the superficial cervical, the posterior cervical. Okay, let's see the supraclavicular. I'm gonna pull your shirt a little bit. Now, none of these are being able to be palpitated, which is good. So let's go ahead and look at your deep cervical chain. Now, do you feel any tenderness as I do this? Okay. And there is a submental one here. Can't palpate it. And there is a submandibular right below your mandible. Okay, and that completes the lymph nodes. Let's go ahead and move on to your lungs. You look to be in a comfortable sitting position, no labored breathing noted. You are breathing clearly. I don't hear you struggling to breathe in this moment. You're comfortable. Your respirations look regular with a normal depth. The rate of your breathing, okay, a minute passed up. He has 14 respirations a minute. You seem to have an appropriate thoracic cage size. I don't see any signs of a barrel chest. I'm going to say you have a 1-to-2 ratio from the anterior and posterior aspect of your thorax, which indicates a normal transverse diameter. So I'm going to have you say 99. Go ahead.
99. 99. 99. 99.
Okay, and there was normal sensation of tactile firmness. While I'm back here, can you put your arm down for me? Okay. Go ahead. Oh, you can't see it. Go ahead and inhale for me. Okay. And there is equal bilateral chest expansion on inspiration. While you're back here, let me go ahead and check out your back lung sounds. I'm just going to be doing 2 upper, 2 middle, and 2 lower. Okay. Is it okay if I pull your shirt up a little bit? Okay. Can you sit up for me a little bit? And I'm going to go lower now. Making sure to hold for a full breath, inspiration and expiration at each location. Okay, can I have you turn around towards me? Okay, sit up for me a little bit. Again, we're going to be assessing Yeah, I'm not hearing any wheezes, rales, rhonchi, no pleural rub. again, making sure I hold for a full respiration at each spot. And I'm gonna go ahead and on your skin, I'm gonna listen on 2 locations on the side. Okay, and all lung sounds were clear and normal. I would perform hand hygiene. Thank you for being a part of my validation.